Hi, we're coming to you from the Radiation Research Society meeting in Fort Lauderdale. And we're here today speaking to Dr. Angela Groves from the University of Rochester. So Angie, I'd like to start off maybe by getting you to introduce yourself and what you do.
Okay, I'm a postdoc at the university there, and I work with the effects of radiation on the long-term outcomes and complications, and my specialty is the involvement of the immune system on these late complications to radiation.
Mm-hmm. So from looking at the work that you presented in your poster, it really looks like you're taking a good sort of systems biology approach here in terms of looking at the effects on the lung, but you're also looking at the effects of the immune cells that are part of that system, and
Yes.
Looking at them in the draining lymph nodes and other areas.
Yes.
So I was wondering if you could give us a little bit of a taste of the sort of hypothesis that you're looking into and some of the techniques that you're using to do that.
Yes, so I believe that exposure to radiation alters the whole microenvironment of the lung, and that the immune cells are able to interact with all the other components, of the system, so that the cells infiltrating and exiting the lung are going to have an altered phenotype and have altered functioning after radiation because of the radiation-induced changes in the microenvironment. And I use flow cytometry as the main technique to assess the changes that we're seeing in these different immune cell populations after thoracic exposure to radiation.
Mm-hmm. And so if you could tell us a little bit about, so you're looking perhaps at the skewing of the immune cell response in T cells depending on the radiation exposure. Is there something that we can take from this that you can foresee as being a way to intervene clinically, or is this something that would help us in a sort of a diagnostic fashion, or?
I think that understanding how these immune cells are interacting with each other, so how the T cells and the macrophages are regulating each other and the responses of how this can set up the parenchymal of the lung, the epithelia cells, to either start a fibrotic response. That is where I think it would be a good place for intervention. I don't know if that...
Yeah, no, that's perfect. So, can you tell us a little bit about how you started in this area? Is this something you started back in your PhD and earlier research, or is this a new field for you?
Oh, it's something that I've kind of translated from my graduate work to my postdoc work. I did lung research and looked at, part of it involved looking at macrophage populations in the lung in response to exposure to ozone as a model of air pollution. And yeah, it's very translatable to a different type of lung injury. Mm-hmm. And the immune cells are activated differently in these two different types of lung injury, but there's a lot of similarities in how the lung is reacting to an injury and trying to recover from that injury.
It's very interesting to think many people come into this field sort of from a basic biology medicine, and they move into the radiation side, and then others start in radiation and then take on a sort of a more clinical or biological aspect. So it's interesting to see how everybody comes in from their own sort of perspectives. So,
yes, definitely.
Do you think there are other organs in the body that might have sort of a parallel process going on? You've talked about the lung and the immune system there. Are there other organs you think that might be applicable to the same type of responses?
I think so. The cells coming from the bone marrow and infiltrating into these tissues, they can be sort of primed or activated to have a certain response, but it's all very dependent on the microenvironment of the tissue that they're entering. So I think that the responses of these infiltrating cells are something that would be important to look at. So are these inflammatory monocytes coming into the tissue and starting to promote profibrotic processes, for example.
Mm-hmm. So is there anything in the work within your lab that's looking at how you could potentially modulate these responses, or any way that you could sort of either reverse the effects of the radiation or somehow combat that change that you see in the immune cell sort of phenotype?
So we're looking at what happens when you prevent some of these inflammatory cells from entering into the tissue in the first place. Does that help remove some of this signaling? Also antioxidants and I think ways of regulating how these immune cells are phenotypically polarized or activated can be a technique that could be exploited in the future for these sort of interventions.
Sure. Is there anything that you've seen so far at this meeting, or anybody's presentation or something that's been relevant to your own work here, or any ideas that you might have got?
Yes, just right beforehand, Marie-Catherine Voisin, thank you. She presented a really great talk showing that these alternatively activated, chronically activated macrophages play an important role in fibrotic responses to radiation. And so it's good to see that I'm not the only one with this idea, and that that it's an area that is in need of more exploration.
Now, certainly one of the values of these meetings is that you can come and you can see sort of work from a lot of different approaches and see how that comes together, and you're always often surprised at where you can see relevance from other people's work in your own field and coming up with those ideas and things. So you're an SIT member of the society? So how long have you been an SIT member?
This is my second year.
Okay.
Yes, and it's a great society because they do a lot for the SIT members. The day at the beginning of the meeting was really a nice opportunity to not only talk to all the other SIT members, but also to talk to more senior members as well. And I really like that they attend the SIT talks and can contribute to them. And they're very friendly and approachable. And
oh, that's great. It's great to hear the good response, and a great advert for all those people who might be interested in joining up. So I'd like to thank you for coming and talking to us today, and we'll hope to see you again next year and to see how your work's progressed. So thank you very much, Angie.
Thank you.